Okay, so in 2023, we housed and served 354 people, which is more than Claire's ever served in a given year. And that is, you can understand why, because we leased up Bloom Lake Flats, which is our newest property in the partnership, which we started leasing in early 2023, and so just over a year ago. And that building has an additional 42 units and 15 are designated for families. So with that, we saw this big increase in the number of people under 18 that we are now serving. We used to only serve kids when we were in a scattered site apartment rental, and now we have people in one of our actual sites, lots of families with kids. We also instituted a new resident advisory council, which I could talk about for a long time, but there's been ups and downs with us trying to do a resident engagement or resident board kind of a model for many years. So it started and stopped, and this year it took off and it was awesome and it's going really great. And some of the things that we changed are just the model of facilitation for that group and then membership. And then the amount of work that we put into getting residents actually here for those meetings. So that's been incredibly effective and impactful. We have staff that get invited depending on who the council wants to talk to. They are meeting every month and have really informed how are things going, like how we know what the numbers look like, we know what the outcomes look like, but how are things going for residents day to day? We have participation from all our programs, so care homes, the apartments, and the scattered site. And one of the things that's been really interesting and very common in some of the feedback we've gotten is that there's a lot of concern around how do you transition from harm reduction to long-term high quality of life living for someone who's come in who's maybe been struggling with substance use and corresponding issues that result from that, and then they become stable. They love living here, but there's still a lot of chaos around that with other people coming in who are experiencing those same things. So that's been a really super relevant conversation beyond just the property management level, and really to look at who use people at stages who are coming in and need different things. So we don't kind of, but that's a major issue. Another thing we did, which has been press or publicity, but we launched a program, small scale hotel to housing is what we're calling it. This was in October, I think, that we finally opened the door. The idea was we just go directly to doing camps where people are living outside and have been part of the HIV outbreak. So they got a new piece of HIV in the outbreak. They are using drugs and they're unhoused. So that sort of makes up that cluster. And so we went and working with other partners, we were able to identify people who wanted to move into housing, and we worked with hotels and we got them in housing.
Well, we've only done it in solo, so it's a small scale at this point, but really looking at if you can cut out all the barriers or the handoffs between different agencies and providers and systems, can you actually get people housed where it sticks, where it works? And so far, we're seeing that yes. So we can talk more about that. We are in the midst, and this is where our CFO and controller come into play, but we're in the midst of doing a much more in-depth financial analysis of our programs. So we always have, monthly financials, but what we hadn't done until this last year is really take a better deep dive into allocations of our admin time, our fundraising staff time, like everything that's not billable to a grant or a program, and said if we actually looked at our supportive housing apartments, scattered site, and our care homes, where are we actually floating, where are we sinking, and how do change the ship on some of those things. So we've been able to identify some of the areas of loss and are working on some strategies to make up those losses specific to the program instead of just saying like fundraising team, go make more money out there, which is great too. That helps a lot. Um, so really pinpointing where those losses are coming from. Let's see. Oh, if you've looked at all into our advocacy stuff, we've been really active the last couple of years at the Minnesota legislature, and a big win last year, which is set the stage hopefully for next year, is that it's a loss followed by a win, but DHS had announced they would be cutting all of the providers who receive Ryan White funding, so we're one of them. It's HIV specific funding through HRSA, and then some other related programs. And so they announced we're going to cut your contracts. We already had signed contracts, we had staff in place, everyone was cut, and we really came together as a community of providers, advocated at the legislature. We had good reception there last year, which was great. And we, for the first time since 1992, saw the first increase in state dollars that went to HIV, which is crazy, right? So that was really big. We're very excited. So that made up for the cuts, and then there's some extra dollars that are being part of an RFP process currently. But what we really want to do is take that and say, hey, we need to keep this up, and we need to build on this because we really could end new HIV if we had enough resources to do it. So really looking to next year as the next budgeting cycle to build on that. So if you're into that stuff, we'll tap you for sure to keep advocating. So, next I'm going to move to some of our equity teamwork. We've been working for a couple of years now to really formalize what is Clare's role when it comes to racial equity in this community, but also internally within our buildings. What does that look like, and who can get involved? So we have an equity team that's now been going for over a year. It's internal, and we had solidified 5 major goals or projects that we're working on, and I can expand if people have questions. One of those projects was really focused on our values, knowing that our staff and clients come from this huge range of experience and backgrounds and things that they're used to or not used to. We really looked at how can we unite and have a guiding set of principles. So when you're faced with something you don't know how to deal with, or you're unsure about a conflict, let's go back to these values. So we spent about a year gathering input, working with these potential values. And as Chris knows, because he's been part of that work, we finally have a final 3 values that we hope to operationalize after we bring to the board and staff and resident council for approval. So one project that we're like see the end line, but as again Brian also pointed out, we now have to work on that implementation. So once you have these values, how do you actually get people to use them and make them meaningful? So that work is ongoing. We also have a great, which there's no evidence in here, but a new visual representation project, which will hopefully change each of our buildings to have more physical artwork and pictures that represent what our clients want to see when they walk in the door. So not us picking it, but clients deciding, here's what makes me feel safe and welcome when I come into your building. So that's just an example, a couple too. I think being a bit pregnant makes you a little bit more winded, if that's a thing. So take a little breather. Okay. Um, so that's kind of some behind the scenes work. Another behind the scene change is related to our finance committee. So this is the committee of the board. We worked pretty diligently on some new investment strategies and included a major change in how we are investing our long-term money, and really made them mission aligned. So we pulled them out of these kind of standard investments, and we're able to put them in a vehicle that we can say, hey, we really believe in these types of missions, and that's where we want to put the money. So we made that shift over the course of many months and research with both the committee and the board. In addition, we also were able to diversify some of our banking relationships. So instead of just all in one bank, we really looked at who are our partners out there and who have mission aligned banking systems that we want to be a part of. and invested in 5 additional banks in that way. So pretty excited about some of those not stuff you'll see in the annual report changes, but another new thing is that we just hired, but we were awarded. This is a kind of a big expansion. We were awarded a short-term rent with utility assistance grant for Greater Minnesota, which is very new for us. So, taking us out of the metro, we've just hired a program administrator for that, and it is more akin to our scattered site work. So we'll be working on getting referrals from across the state and be able to assist households with that one to 3 months rent, utility, or mortgage assistance. And that's funding through MHFA, or Minnesota Housing Finance Authority. And really what we put out there to them is that our intent is really looking at long term, what are the permanent housing needs? How can we help address that? Because that's what Claire's really good at. And how can we be a part of those solutions? But we don't want to jump in when we don't know that much about Greater Min or the need or the locations and how it would work. We really feel great about getting this first set of funding to kind of practice and not just practice, but get to know communities and start exploring what the future might look like in Greater Min. It's probably not going to look like this here today. And one more sort of highlight, we launched an HR committee of the board, and doesn't sound super exciting, but we've been able to establish our first set of baseline metrics that we can update more regularly, and then goal setting around recruitment, retention, especially looking at a more racially diverse management team. That's where we really fall short um, internally when you look at our staff makeup. So that's the highlight. I'm going to move, and if you didn't remember everything I said, you want to talk about some of it later, they're written over here just as touch points. Okay, so challenges. We have had challenges as well over the last year. One of the things I talked about at last year's event was the funding we received for Claire Digs, which is the low barrier model that sort of instigated our hotel to housing model, but it would include an actual facility. And the challenge we've had in that is that we have the money, it's sitting at HUD, but it's there, and we just need to find a site. And so the site location has been difficult, largely because we are working with a set of parameters that were created by people themselves. And they have a great list of specific things that they would like to see in housing. So for people moving out of encampments, again, part of that HIV outbreak. But one of the challenges has been balancing location and safety concerns, and sort of like how do you find the perfect spot with both of those in consideration. So we continue to look. We have 9 more years. I hope it does not take 9 more years. Let's hope it's not taking even 2 more years, but that is on the horizon, but has been a challenge. Yeah. No, but that'd be great. A committee is great. The site stuff has been a big challenge in the area where we want to stay, because residents have said, their future residents, I want to be in South Minneapolis, or I want to be in these particular neighborhoods. So that's a great idea. Other challenges, we've had increased vacancy rates in our buildings, not due to the fact that there aren't people out there to serve, but people who want to be here. A lot of it, if you follow anything else among sort of affordable housing providers, we have a lot of issues related to our funding mechanisms and eligibility criteria. So people having to go through a very strict process to get into housing to qualify for funding. That's been a big issue and has created a lot of delays. And then inconsistencies once people are actually in, inconsistencies with actually being able to get that rent in the door. So that's a threat or a challenge. We also have continued to have, if you've been around a while, you've heard about us working on our licensing exemption related to our nursing services. We provide nursing, skilled RN nursing at 3 sites, 24/7. That continues to be sort of under being chipped away by different legislative priorities or initiatives. And so we spent a lot of time on that in the last 3 to 4 years, and before that, I'm sure as well. This year, we're still working on defending sort of our ability to provide those services within a building like this, which is not an assisted living building. And that's the big issue from the disability services side of DHS. So I was fortunate enough to be able to testify on a few bills this session that are still working their way through, and look forward to doing more of that if hopefully on the front end. I keep thinking like maybe next year we'll come and be like, here's how we should do it, instead of sort of defending like, hey, don't change it this way. But we're still working on that. We also, this is a great example because we're at Clare Northeast, which is our first apartment building that we built. And we are now in the 19th year of this building, which is wild. And when these tax credit buildings are built, typically the application that goes into MHFA, 15 years of funding for reserves. So you put in a budget that says that year 15 will be $0 in our bank account. We'll have zero for renovation, for operating, because we're not making money on this building. So those got awarded, but now we're in year 19. So we have been applying for 3 years to get preservation funds for this building. We've been declined because it's in good enough shape, and we're kind of at the end of that line where, one more year, 2 more years, we fully expect the HVAC, the roof, the elevator to need substantial upgrades, which is why we're applying to recapitalize the building. So that's just one example, but it sort of leads the way for our other buildings and sort of seeing what's our pathway here, when the intent behind whoever created that policy 15, 19 years ago was that you would come back in for recapitalization. So challenge there. One of the successes I mentioned is having much better up-to-date resident information. What that helps us now see, it brings up racial disparities in our outcomes, helps us highlight how are things different for different people who are coming into the building. So then the next thing is, okay, now what are we going to do about those disparities? How do we address them? So we have the info, now we got to do something with it. And then to end on a challenge that, again, is often in the news right now, we have experienced 3 overdose deaths in the first 3 months of our year, which is pretty unprecedented for Clare. We typically have not seen that. They've all been in our apartment buildings, and it's part of this major change in our communities, I think. We're seeing a lot of fentanyl and opioid mixed with meth and other drugs, and the access and the affordability is really making an impact on our residents, our staff, and our communities. So just want to highlight that that is also a challenge going on for us in 24. Okay, what's next? Okay, I hope I'm still, yep, yes.
Are you developing and changing policies regarding the overdoses to buildings to kind of go with the flow of how things are happening?
Yes and no. So question was, are we evolving our policies and practices? We are working and have been applying for funding to be able to bring in recovery specialists and mental health specialists. We have not been successful in that yet. One of the things that we have really butted up against is that our housing has a lot of protections for renters because everyone's a leaseholder, which they should be. But that means that we can't we can't necessarily say we are going to ask you to leave by doing these behaviors or by having drugs in your unit, unless we're going to ask everybody to leave who's doing the same thing. And so we have a lot of that goes back to that balance of like, where's the harm reduction and the housing piece, housing first, versus keeping the whole community safe. And if we decide to enforce that, we would enforce it universally. And then how many people would that impact, when really it might be the behavior of one that's causing a biggest issue, if that makes sense. So we're having these conversations weekly with our property management team They're the agency, they're a third party that we hire, and they are the property manager who enforces the lease and the regulations that all of our tenants have to abide by. So yes, more to come, but definitely not, we definitely don't feel confident about like, we have a great plan or solution for this. But that's a great question about like sort of like what's coming. So we are, we've talked, oh, thank you. Oh, look at that. I'll put it here, thanks. So we've talked about some major upgrades in our financial management. And in 2023, we ended the year better than anticipated. We had anticipated a loss, so we had a loss, but not as big of a loss, which is a win. That's a good thing. And now we do have a vastly improved financial accounting system and tracking of every level of detail related to financials. So that includes service, enrollment, rent, payments across the board, and pretty excited about that, which is helping us do a better job of budgeting and forecasting. We have similarly made these major improvements in our client record system, which if you're a data person, we could get real deep into like how we can cross compare data by age, by site, by type of funding stream, all the stuff that we had no idea about before because it was all done kind of by hand. The new initiatives I just talked about that we will get off the ground include the Greater Minnesota Short-Term Rent Assistance Program and Clare Digs, again, finding a site, but also continuing to pilot and roll out the Hotel to Housing program that's now started its second funding cycle. And you'll see more about those things, new actual sort of housing unit type things in our upcoming development related news. So that'll keep coming throughout the year as we know more. And to your point, Gage, really looking to deepen our mental health services and our on-site services. So we've worked with other providers. Often there's interruption because of staff shortages at those providers or changes in their policy priorities. So we're starting to look at what would it take to have those through Clare where we can really dictate, hey, this is where the biggest need is. This is where we need your help. So we are relaunching some mental health services and continuing to apply for additional deeper dive kind of services for our residents on site. And lastly, we have the beginnings of a 3-year plan, which is a little bit different than a strategic plan. We have a strategic framework that was adopted or revised and adopted in 22, but the 3-year plan is really looking at how can we take those big goals, break them down, what will the financial impacts be, and then how do you roll those out to the whole staff? So it's not just me and the admin team, but it's frontline staff that have an impact on all of the things that we're talking about, on the quality of services that we deliver and the outcomes. So we're pretty excited about that too. Okay, so those are my updates, and I would love, I have some like asks of you or questions, but before I get to that, because I want to be sure I have time to answer your questions, so first I will stop and see, are there questions about anything I've already talked about or that I didn't get to that people would like to explore more? This is a great time. You need a sandwich board walking around. Yes.
It seems that in all of my experience where you've always been very lean to staff, and I'm just wondering, it sounds like you've built up some capacity in financial. Are you building it elsewhere too?
Oh, great question. If you didn't hear it, it was that Clare has often been very lean in our history in terms of staff. And it sounds like we've built up a little bit of capacity in the finance role. And are we building it elsewhere? That is a great question. And we are, I would say, still struggling on the hiring front. We're still very much seeing a gap in qualified applicants coming in for the frontline positions, which is often the most direct care positions, particularly evenings, overnights, weekends. And when you're running now 8 sites that are 24/7, that's a huge challenge. So we continue to, um, part of that HR committee I mentioned, we also brought in-house our HR staff for the first time. We'd been contracting out, which was okay and a little bit cheaper, but really reactive instead of proactive, just so reactive versus how do we get ahead of this. So she's now been in-house for 2 years, and a huge focus has been on retention and recruitment. But I feel like, again, it's not enough. We're still seeing almost every program saying, we're short-staffed, we're short-staffed. So great question. Some of the stuff we've done has been addressing sort of the cultural inclusion elements. Some has been increased salaries, and we still, and major improvements on sort of professional opportunities. So helping people move from that frontline position to the next level up, to maybe the lead, to the manager, that type of progression. But we're still just not getting the applicants in the door has been our major problem. And I don't think we're alone. We feel pretty competitive on the salary front, but it is an issue. Yeah. Yes, Jenny.
And I think over the past couple of years, there's also been additional positions added. I think the liaison and case management positions. So kind of over the longer term, added capacity with roles that are very specific. I feel like that has been a slow build, and that will continue.
Yeah, for sure. We used to have maybe one case manager, so everyone else was like a frontline or a manager of other people, and now we have much more nuanced positions. So our healthcare liaisons are coordinating the healthcare within our home care program, so people with higher level needs, and things that the nurses don't need to do, so that the nurses can do just the stuff that they need to do. And now these staff are doing all the appointments and the stuff that takes hours of like waiting on the phone to reconcile 2 different doctor notes, like that kind of stuff. So adding some nuanced positions for sure has helped retain some of those people who are like, I love Claire, but I'm burned out on this, second shift work where you never quite know what's going to happen on the shift, and you're all on your own when it does happen. So that's definitely helped. Yeah, I am. Yep. Any any HR people, that's one of the committees that we're still recruiting for, because we would love some more experts, non-board members, to serve on that committee. So that's a huge area of need that we're talking about every month at that meeting. And if you or you know of someone who's an HR specialist or HR enthusiast who would like to serve on a committee, that would be a great referral for me to get. Yes, I'll go with James.
What's like the Cliff Notes version of the increased vacancy units, and like what does a resident go through to get approved?
Yeah.
And like, are these new challenges that they're facing? And if not, what are ways that we can advocate to maybe make that easier?
Great question. Okay, so about entry intakes. Each of our buildings has we call ourselves deeply affordable housing because every unit in Clare Housing is subsidized. There's a subsidy to help pay for rent. So the people we're able to bring in are all coming from very low income. So often $0. Maybe they'll have Social Security, but everyone we're serving when they come in is under 30% area median income. So they can't pay the whatever $1,200 a month market rent. So and that was intentionally designed so that we could serve people that needed housing support. So every building and every unit has a rent subsidy attached to it. Often the majority of our rent subsidies are through Hennepin County, which also requires a homeless status that has to be verified through their system. So when we have an opening, for example, our process is our intake coordinator, which is also a role we started a couple years ago. Our intake coordinator reaches out to the county coordinated entry system and says, we have a unit, but we say we have 3 because we know it's going to take 3 when we really have 1. We have a unit. They have 2 weeks to get back to us with a person, a name of a person. That person has to have completed an assessment that shows that they're homeless, but also a number of other vulnerability related indicators. So disability, maybe a mental health disorder. They have to be listed as a priority with the county. And then for us, they also have to have HIV. So if they didn't disclose their HIV status, they're not going to get referred to us. So once we get those people, it's been 2 weeks since we asked. It may have been weeks since they did their assessment with an assessor who had to be approved by the county. Then we have to find them. We meet with them. We say, are you interested? They say usually yes. And then we can't find them, and we have to wait 2 more weeks before we can go back to ask for another, which is why we request more at the beginning. This is a long explanation, but so then they come back. Let's say they like the unit, the housing. Yes, great. Now we have a packet of paperwork we have to get them to fill out, which usually you can't get done right then because it requires documents that they don't have on them or information they don't know. So then we try to continue to stay with them for 30 days. If we lose them within 30 days, like we can't find them or they don't come back, then we can take someone new from the list. But usually we can track them within 30 days since we moved to this new intake coordinator role. So we get the paperwork in to property management. They have time to review it. If it's a Section 8 unit, Minnesota Public Housing has to then come review the unit, even though it's the same unit they have reviewed, 6 months earlier. But so that's all figured out. They have to do additional paperwork for their ongoing rent payments. We have to collect new stuff, even though it's all going back to the county, and the county already sent us this person. And then we get them moved in. So if anything hiccups in that process, the delay is very great. We just had a long one because we had somebody identified who was going to come into our nursing services. So she additionally needed to be assessed by the nursing team to make sure we could meet her needs physically. She's also dealing with addiction, so she didn't make all her appointments. It took a little bit longer. She was slated to move in, and then she was in the hospital. If you're in the hospital, your eligibility time period can kick you back out of the process after 30 days, etc. So it is ridiculous.
To separate, I'm sure the other people have to work with, can you find that like the barrier is the system itself? And is there a way to change that system?
Yeah, I think so. I think the barrier is the system. I think this is my personal perspective, not Claire's, but I think the amount of money and energy and time that our service system puts into compliance and monitoring and like making all of these like checklists that you have to do, I'm like, how much more could we get done if that was just being spent on serving people, on housing, on getting a staff member in there to work with somebody? So that's kind of where the hotel to housing came in. We have money outside of the county, outside of DHS that said, hey, if they're HIV positive and they're homeless, you can just house them. And we are. It's like, oh, look, we can actually do that. But we used our entire grant the first 4 months of time we had it. So we had to wait for the new renewal to come in. So I think so. And I know that there's a lot of like, oh, but there's bad actors out there. I'm like, yeah, then go after the bad actors. Most of us aren't, but yeah.
And just, this is more of a comment than.
Oh, yeah,
question,
please.
but with system change, a lot of us that are at not-for-profits and nonprofits, we need money to change the systems, right? And so what Claire is doing with the hotels to housing is kind of going around
Yeah.
the system in order to implement services, which is a big deal within itself.
Yeah, thanks. Yes, John.
So this, my question goes to system grade as well. I think I heard you saying that you're maybe not changing emphasis, but shifting to an all including an emphasis on long-term, high-quality housing and people thriving in the community, what I would call thrive versus survive.
Mhm.
Um, my professional experience is that it's very hard to sell that to funding agencies who are totally focused on the crisis response survival thing. I think it's a great idea. But what theories or what ideas do you have about changing that system?
Yeah, that's a great. So part of that goes back to our board, and there's a couple members here today. But one strategy we have that actually has worked well for Claire is that we have different types of housing for different people, and we always have. Well, we have since the 90s at least. So people need different things. And I think that that is something Claire has done really well. When someone has been in the care homes that needs help transitioning to the bathroom or getting their food made, we're able to do that. If their condition improves, they're able to come out and be in an apartment or in scattered site. And so we do have some tiered sort of different types of housing for different needs. So I think that a lot of it is making sure the whole board and agency are on the same page about what that next chapter looks like, which is how do we have, where do you go from Claire, right? Like if you're at a Claire building and you want the next step, how can we support you in that? So we are not, don't quote me, this is not a thing we're doing the board, but things like home ownership, right? We've never talked about home ownership. That's not where our clients are at. And maybe that isn't where they'll be at. But maybe there are a couple of our 300 clients that could make that transition in the next couple of years. So I think that the strategy is laying the groundwork, talking about the impact to the clients, which is what we're hearing just resoundingly like, I love it at Claire, I love the support, but I don't want to be in a situation where I'm seeing drug use. So how can we support you even if you don't have enough income to go get a market rate unit? So I think we're in the process, and it also goes back to that 3-year plan of like, how do we diversify? How do we stay relevant to our clients, not to our funders, to our clients who need us at various stages. So one example, we're looking at a different type of housing unit that would be for people 55 plus living with HIV, which is a very different housing than what we have today. Would look different physically, but also the services would be different. So that's one example that's already been floated by the board and approved for further investigation. But hopefully that answers some of it. I think it's in the groundwork stage. And then we have to figure out the long-term funding implication, which is what Mike's going to do for us before he goes.
I think also like implementation, piloting programs. If you do it on your own, a lot of times the government will look at it or funders will look at it like, oh, you have proven through
You
these
can do it.
projects that you can do it. So we might offer funding for it.
Right. Yeah, which is kind of what we're doing on the very other end of the hotel to housing is getting a little bit of traction pilot and then maybe hopefully growing that on the other end of when I talk about sort of a spectrum of housing. Um, I saw somebody else with a deep question. Yeah.
I really want to dive into this like systems change long term. I've heard you talk a lot about like visions for the future and things that are kind of getting going. And you said like, an HR person, send them my way. I wonder like what other partnerships the firms are doing.
Oh, great. It's like, did someone plant Jay in the audience? Jenny? Okay, that's a great question. So actually 3 specifics related to, so if you couldn't hear the question, it's like what other partners do we need right now to sort of achieve this mission and vision? So with the county, if people are personally connected to and would be willing to invite me to a meeting with our county commissioners, we know them, obviously, we send them emails, but looking for a really warm connection with 3 in particular. So Irene Fernando, Angela Conway. I always get the last initial, and the one I'm sure you all know, just it's written down. Jeffrey Lund is our council member over Robbinsdale, so we have the least sort of like contact out there. It's our terrace building, but those three are people we would really love to get the ear of to talk in depth about some of the systems that are not working for our residents through the county. So if you know people or you're friends with someone who's friends with them and wants to have a long talk with us, that would be great. The other thing, HR and also advocacy committees are two areas where our committees are short members, and we would love additional experts who are willing to serve on those committees. And we also have a finance committee, properties committee, which are pretty well, like we have good membership, but it's never bad to have more experts on those things, particularly if you're in property management. We're looking for a property manager that's not our actual property manager to help advise on that properties committee. So that's a specific one. Then there's a couple other things related to like spreading the word about Clare. So we have for the last, since COVID-ish, we've started doing this. We've been doing a monthly HIV 101, HIV and housing, HIV and homelessness 101 online 30-minute session to just inform people about the intersection of housing and healthcare. And we have struggled to get people to come. So that would be great. And it's something Debbie schedules. Well, either we can get you in touch with the scheduler. And what we've realized is we used to do it in person pre-COVID, and we'd get people and they'd come and they'd tour the building. And now they don't want to come. People just are, it's like we can't get people to come in person, let alone to the like 30-minute webinar. So part of it is just like, do you know 2 or 3 people that you could leave here today and talk to about Clare and see if they'd be willing to come to a session or come to our event in September. So a lot of it is just like getting people to know about us. So many times people are like, I've never heard of Clare Housing. I know you haven't. Oh, that's a great, yeah. We have a couple open positions. We are retooling. I think I mentioned our mental health, but we're also retooling our nursing lead. So we're looking for a director of health programs, which is very different, again, than sort of the other housing stuff that we do. They do not need to be licensed professional, but they'd be managing our nursing program and our mental health program. So someone with a lot of like attention to detail is something we're looking for. What else am I forgetting? Case managers. We have open positions for case managers. Gage knows this too, I'm sure. So if you've got someone who's like really, again, wants to be around clients, cares about HIV and housing, has some experience in the field, they'd be a great one to refer. Yes.
Back to advocacy, you mentioned, some commissioners, what you have with the city council, we have many of them. How about at the state level?
Yeah.
What do we need there?
Whew.
Who do you need?
Yeah. Yeah, okay, that's a great, so I've got some names, but specifically, we are in this weird position between housing and health. And often the two, it's like the state wants to keep them separate. So DHS does everything with disability services. And then our county is doing all the stuff with housing. And so we see a lot of conflict between those. So we've really focused on health and human service, people on health and human services committees. But we often get dragged into things around assisted living, which is, so there are a couple people specifically like Representative Noor, Karen Housley, if anyone knows her. Rep Lee from West St. Paul, there's a few people, but I could expand on that if you're interested. In the Senate, I can't help it. I got to give a plug to Senator Dibble. He has been such an advocate. So I feel like if we can just keep him in there, not that he's the like silver bullet, but wow, Oh, he has championed for people with HIV from day one, regardless of if that's housing or medication access or healthcare. So he's been our go-to, but it's better to have more than one go-to. He's really been it. Oh my gosh, I'm gonna forget her name. She just stepped down as the lead of the Senate, Carrie Dietzig. We've failed to get her in the room. She's pretty busy, but it would be great to get some of the leadership to know who we are and what we do.
So like a John Hoffman.
Yes. Hoffman, Abler and Hoffman have been actually great. I don't know how, but they're just great for us. I don't know if they're great for other people, but Hoffman and Abler this session both made comments about how we needed to adjust this legislation in order to make sure Clare can still do what we're doing. That's the kind of advocate we need. So if you know them, big kudos to them.
We need advocacy with representatives who are outside of the metro area.
Yeah, we do. Although what's interesting is even within the metro, even within the DFL, I think things, again, personal take, are moving too fast at the legislature. So all this stuff is getting put in there that people don't know how it will be rolled out, and especially when it comes to licensing related issues. So they're pushing all this under like consumer protections, but we're saying, well, actually, this doesn't help consumers at all. And so we're asking them to slow down, talk to clients about what they need, talk to providers before they put this stuff forward. So Hoffman and Abler have been like, oh yeah, I know how this, you guys have been talking about this for 10 years, but a lot of the newer people are like, we need more protections. So it's been a really frustrating session in that way. But Abler and Hoffman, honestly, and Dibble have been our champions. Yes.
With you being pretty much the head of HIV housing
Yeah.
in Minnesota, have you ever thought about having the other ASO leadership champion stuff for Claire?
Yes. Great question. So, yeah, right. We have a lot of agencies that serve people with HIV, and it can get confusing for people because we do similar things but not the same. So last year we came together around this funding issue, and we this year then formed an HIV lobby, which is the first time we've done that since I know of. And so Claire's the fiscal leader of that, but all the participating agencies contribute to that contract with our lobbyists to be able to do just that. So the primary agenda is related to things directly and specific to HIV, so like PrEP and PEP access, which is happening, we think, at the state level this year. So that's on the agenda, but then we also have housing stuff that we're able to put on that agenda. So that's new and still in the works because, and still, I should say, evolving because this year we're focused so much on the PrEP and PEP. Yeah, I will. Hi. Yes. We are at 412, which is a lot of people considering we serve around 350 total. So 412 on our wait list that we know about. And then this last year, 2023 stats showed an increase in new HIV transmissions in the state of Minnesota for the first time in many years. So it's not getting better on that front. We have been at around 300 new transmissions. It's kind of been going down. And I think this year we're up to 340. So we think a lot of that is to do with the outbreak. And we, again, go back to like housing is healthcare. If people are living outside, they're not able to manage that HIV, and it's going to keep growing. But more people on the wait list than we're currently serving. Which is why we gotta get these other things going.
How many buildings are in the works?
So in the works, we have 3 projects that are like in the in these kind of works, not under construction. So part of what our properties committee did last year, which was awesome, is create a process to sort of approve new projects before they go off the rails or get too far. So 3 have gone through that, where the board has said, yes, this is mission aligned, this makes sense, please continue to pursue it. But that's the stage. Yep. So we'd go back to the board and say, here's what the actual site and cost and blah, blah, blah would look like once we get there. So 3 of those in the works. I think we're getting close. Jenny's showing me time. Joanne, yeah. We are looking at being the developer. One of those is Clare Digs, so a smaller site, much smaller. We're talking 6 to 8 versus 40. And then the others, we're looking at partnering one with YAP and as a service provider. And then the other is the one I mentioned that's 55 plus. So we would be looking as the developer. And in some cases, service provider. Yeah, 36 to 40 is the target. I think I saw, no.
One more question.
Make it a good one. Did you guys get hot in here? Just me? Yeah, okay. I can't tell. It was just me. We should have. I think that I am just so glad you came, and I hope you give us feedback because we're doing it for you all to know and be able to dig into stuff. So I just so appreciate you spending the time in this hot room and caring really about Clare. That's what it comes down to. So thank you so much for being here. Let's do it again next year. Thank you. You can get more popcorn if you want on the way out. It is very warm.